Hi, and welcome to This Week in East Brunswick, the township's own news and information program. July 1st, Middlesex General University Hospital officially changed its name to the Robert Wood Johnson University Hospital. To mark that change, Channel 8 will visit Children's Services at that hospital on today's program. Our regular features will include Paul Hansen's Money Tips, this week explaining the basics of the financial planning pyramid. Health Facts with guest physician, oncologist Michael Nissenblatt speaking about sun exposure and skin cancer, and Consumer Aware with Adrian Eisner with advice on choosing a health spa. First, here's a look at next week's Channel 8 schedule. Monday at 10 a.m., Look Great, Feel Great with Lenore Kulik offers aerobics and upper body toning. At 10:30 a.m., Dolly Vasta tours the East Brunswick Museum with Estelle Goldsmith and John Runyon on For Art's Sake. Tuesday at 7 p.m., Check It Out will give information about the libraries of Middlesex County. Then at 7:30, Sports Talk with John Magliero will feature a special repeat showing of an interview with New York Giant football great Alex Webster. Wednesday afternoon at 3, it's Reading Rainbows, a PBS children's series. Then Wednesday night at 8, Video Art from Media Mix on the arts from Middlesex County's Cultural and Heritage Commission. Watch again next Thursday night at 7 and 8 when we'll return with more local news and information on This Week in East Brunswick. And don't forget to check the Channel 8 program guide for repeat showings on all these programs. A few weeks ago, we visited the Robert Wood Johnson University Hospital for a look at its recently dedicated Children's Center. We met Janet Skidmore, Assistant Director of Community Relations, at the entrance to the center.
Right now we're standing outside the Children's Center, which was dedicated in November to be an umbrella for all of our specialized pediatric services. I'd like Dr. Lawrence Taft, who is Chief of the Pediatric Service at the hospital and Professor and Chairman of the Department of Pediatrics at Robert Wood Johnson Medical School, part of the University of Medicine and Dentistry of New Jersey, to explain to you further about our specialized services for children here at the hospital.
It's a pleasure to be able to tell your audience that I can honestly say that we really have a major comprehensive center that can care for children and adolescents in Central Jersey. Prior to coming here 11 years ago, New York and Philadelphia were always considered the place to go for sophisticated care for children. If they needed sophisticated diagnosis or any type of surgery that was more than the usual primary or secondary type. And over the years, with the help of the Robert Wood Johnson Medical School, we've developed a faculty that I think is comparable to what exists in all the programs in New York and Philly, and I think we can offer children across the board, and parents too, what they need. We cover every single medical subspecialty and most every single surgical subspecialty as relates to children. And this is from gastroenterologist to neurologist to hematologist oncologist, and I think you'll hear more about these individuals and programs we have. But one of the things I like to stress is that we're here not just to engage ourselves in the medical aspects of care for children, but we realize that when a child is sick, he's not only affects his whole ability to cope with his peers and with school and his feelings about himself, but also his relationships with his family, his mother and father, and his siblings. And most every program that we developed are what we call comprehensive multidiscipline programs, not just medically oriented. For instance, we have a hematology oncology program that has a social worker, and available to him is a psychologist and a psychiatrist, where we help the child, we help the family understand the illness and cope with it and look into their other needs. We have now about 12 specialty programs that range from outpatient to inpatient programs, which include these multidisciplines, not only this medical subspecialist, but all the other disciplines to help, as I said, children and families feel better and be able to cope with their chronic illnesses. Let me give you an example. We have the Laurie Neurodevelopmental Institute, which is a diagnostic and therapeutic center for children who have developmental delays, developmental disabilities, learning disabilities in school. We have a spina bifida program that is for children who have this severe problem with control of their lower extremities. We have a cystic fibrosis program and hematology oncology program. These programs are significant in the fact that you can't find them most other places in New Jersey. And I think that for families that have children with these chronic problems, and especially diagnostic problems, that our hospital and medical school can really offer a needed service in the community.
We also visited the center's playroom and met with Child Life Coordinator Judy Quarles.
Child Life program is basically a program that tries to meet the emotional and social needs of the children when they come to the hospital. We try to offer, we do therapy with children, therapy and counseling if that's needed, as well as provide recreational activities for children which can be therapeutic in nature. And all this to try to focus on their needs and help them to have as much emotional supports as they need while they're here. Hospitalization is can be very traumatic for children, and their trauma and their fear and their anxieties are manifested in so many different ways, you know, sometimes by some resistance to not taking their medications, as well as perhaps they're so frightened that they cannot unwind and make treatment possible. So we try to focus in through play and through recreational activities and just talking, sometimes talk therapy, and focus in and try to help them. Now, one of the things that the Child Life program offers is the pre-admission teaching tour, wherein the children and their parents are asked to come in prior to the children's admission to the hospital for surgery or testing. And if they're going to have surgery, we work with them. First of all, I like to get a sense of the children's perception of what's going to happen to them. Why is it they're coming to the hospital? Then what's going to happen to them when they get there? Because different ages have different ideas about what exactly is going to happen. The ages of the children that we had here this morning, they tend to see hospitalization or perhaps surgery as some sort of mutilation. So it's good to get an idea of the fantasy, and then you try to present the reality, what exactly is going to happen to you, while focusing on their fears and their perceptions. This morning we had two youngsters. We had Joseph and Andy. They are 6 and 5. And before you came in, we talked about what was going to happen. You're also going to have an IV like this, like George. He has his IV in his leg. And right, you see like this, Yaya, he has his IV. You're gonna, when you have your operation next Wednesday, guess what? Your stomach is gonna go to sleep. And you're gonna have an IV like this, where all the medicine is going to come down through the hoses so that you can help your body to get well very quickly. And then when you get up, you'll have this on. Medicine comes down through the hose like this, through these tiny little hoses over here, and it goes right inside of the veins in his body. Let's see, I think you might have yours on your hand like this. You might have yours. Joseph, can I see your hand? You're going to have yours in here. Do you think that's going to hurt? Yeah. I think it's going to hurt for just a little bit. Can you give yourself a pinch? Give yourself a pinch on your hand. Okay. Can you give yourself a pinch on your hand? Right, like that. Okay. And stop pinching. And that's just how it's going to feel when the doctors...
The hospital provides comprehensive outpatient care as well. We spoke with pediatric nurse practitioner and coordinator of the Valerie Fund Center, Alice Rennick.
We care for over 45 patients who have cancer and over 100 children totally who have other kinds of blood disorders or coagulation problems, including hemophilia. We are also part of the Comprehensive Hemophilia Center, which there are 2 in the state. We are part of Children's Cancer Study Group, which is a national group to help find better ways to treat children with cancer. And so we provide those services right here in New Jersey. The diagnosis of cancer is so upsetting as it is that when you think of having to travel somewhere to receive your care other than locally, it just adds an extra burden that really isn't necessary for families. So we provide that medical care, nursing care, and interdisciplinary care actually, as well as parent support groups, children's support groups, and sibling support groups, so that we encompass everyone who's important within a family constellation to help make what's a very difficult situation a little bit better if possible.
We'd like to thank the Robert Wood Johnson University Hospital and especially Janet Skidmore for their assistance in putting together this piece.
I'm Paul Hansen with this week's Money Tip. When we speak of financial planning, we generally base our philosophy upon the financial planning pyramid. The financial planning pyramid consists of 3 levels. The first is, of course, the foundation. These are non-risk, cash and insurance type investments. For example, savings bonds, money market funds, and cash value life insurance. The second tier is called the break-even stage. These are traditional capital conservative type investments with a 10 to 20% annual yield. This might include income-oriented stocks, unit investment trusts, and 2 to 3 year treasury notes. The final tier of the financial planning pyramid is reserved for growth. These are long-term, real growth type investments with a 20 to 50% annual yield potential. This would include penny stocks, undeveloped land, and venture capital opportunities. It is important to bear in mind that one's investment portfolio should be made up of 90% of tiers 1 and 2 and only 10% of the high-risk, high-growth third tier. There's no one better able to manage your money but you. Make the wise decision. I'm Paul Hansen, host of You and Your Money, with this week's Money Tip.
And now for Health Facts with Dr. Michael Nissenblatt. Dr. Nissenblatt is a clinical associate professor of medicine at the Robert Wood Johnson Medical School, a fellow of the American College of Physicians, and a medical oncologist with a private practice in New Brunswick. He is currently president of the Middlesex branch of the New Jersey division of the American Cancer Society.
Rudyard Kipling reminded us that only mad dogs and Englishmen go out in the midday sun. But there is a primitive or instinctual need to bask in the rays of the sun. Solar rays heal the body and comfort the soul. Our New Jersey beaches are among the finest, and any body surface which can be legally displayed receives direct light from the sun, and thusly its deeply penetrating ultraviolet rays. But there are many potential risks that bear comment during these, the finest days of summer. Persons with excessive exposure to ultraviolet light may develop cataracts, premature aging of the skin, eye cancer, and skin cancer. The ultraviolet rays are injurious because they shut down our body's immunity and injure DNA. That ultraviolet rays are injurious to our skin is self-evident. Have you witnessed the deeply tanned and leathery hide of a long-term habitant from southern Florida? Skin becomes hidebound and deeply creviced. This is a sign of premature aging. We have learned that cancers abound with greatest incidence in the elderly population. However, skin cancer is not limited to seniors. We all have met persons or have heard of people who have had cancer of the breast. But did you know that for every cancer of the breast, there are 2 skin cancers that occur? Nearly 500,000 skin cancers will develop in 1986. Our president in 1985 and our vice president in 1986 both have been affected with skin cancers in heavily sun-exposed areas. And yet skin cancer is one of those disorders which is entirely within our power to prevent. There are 3 types of skin cancers: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma usually starts as a small, round, smooth bump with a pearly surface. It may become itchy and peel or scale. Any open sore that fails to heal, or a new red hard patch on the skin, or a scar-like area of the skin with a yellow, white, waxy surface fits the bill. It is the lesion on the chest, the shoulder, the arms, or the legs which is important. If you have one of these, have a physician check it, because it can be treated readily and without any deformity. As long as early diagnosis can be made, cure is expected. Malignant melanoma is a much more serious disease. It is a form of skin cancer with a tendency to spread. 25,000 men and women will develop malignant melanoma in 1986. It is most common on the chest of men and on the legs of women, the sun-exposed areas. On occasion, it may occur on the back or face. But most of the time, malignant melanoma occurs in people who have had a predisposition. They may have many colored moles or large hairy moles. Their skin may be fair, their hair light, or their eyes light in color. Persons who are at increased risk have a tendency to develop sunburn rather than suntan during the summer months. Do you have any of these risk factors? Has anyone in your family ever had a malignant melanoma? These are the common risk factors and indicate a need to exercise caution and to look for the following warning signs. 1. Changes in the color of moles, either a deepening of the typical brown color or the development of black within the mole is an important sign. Occasionally, red, blue, or white pigmentation may occur within these confines. 2. An increase in the size of the mole. 3. A change in the shape or the border of the mole where it joins with normal skin. 4. A change in the surface with crusting or bleeding or ulceration. And 5. The development of pain within the mole. If any of these risk factors are present, have your doctor check them. Simple removal is curative and non-deforming. Waiting can result in growth and permit spread. Remember, there are several ways to prevent skin cancer. Get to know your skin. Check for birthmarks, especially those on the feet or back or chest. Examine your skin at regular intervals, particularly during the summer months. Select a physician who can assist you in evaluating your skin and in determining whether or not any skin moles or other abnormalities are significant. Enjoy the sun, but be cautious. The rays are strongest between 10 in the morning and 2 in the afternoon. Listen to Rudyard Kipling. Only mad dogs and Englishmen go out in the midday sun. And wear sunscreens. Use sunscreens with a skin protective factor of 15 or more. This should be applied at intervals of 2 to 3 hours, especially when persons are basking in the direct sunlight or sweating or swimming frequently. Avoid tanning booths, which are not safer than exposing yourself to direct mid-afternoon sunlight, and wear dense sunglasses to protect your eyes and to prevent cataracts or melanomas of the eye itself. The Skin Cancer Foundation has been looking for slogans to encourage people to exercise caution in sun exposure. One such poem follows. Wrinkle, wrinkle, little star, though the eyes come from afar, you should have gazed more at the moon. The sun has left you like a prune. This is Dr. Michael Nissenblatt for Health Facts.
Hello, and welcome to Consumer Aware. I'm Adrienne Eisner, Director of the East Brunswick Consumer Affairs Office. The East Brunswick Athletic Club, which was located at the Midstate Mall, has closed permanently. Our office has contacted other health clubs in our immediate area and has compiled a list of the clubs and what discounts they will offer to the members of the athletic club. If you have not already called us and would like to receive this information, please call us at the East Brunswick Consumer Affairs Office. The phone number is 390-6954. While we're on the subject of health clubs, if you are doing some comparison shopping for a health spa, here are some suggestions. Make sure that you take the time to inspect the spa that you are considering joining. Visit during the hours that you would normally use the spa. See if it is overcrowded during that time. Notice whether the facilities are well maintained. Inspect everything for cleanliness and also note the condition of the equipment. Ask these questions. How many members do you have? Is there a limit to the number of people who can join? Many spas have no membership limit, so while the spa may not be crowded during your visit, this condition can change. Ask what hours you will be able to use the spa. The spa may be open all week, but may be limited to men on some days and women on others. Find out what qualifications or training the instructors have. And before you sign a contract, see if you can answer these important questions. Is everything the salesperson promised to you written into the contract? If a problem arises after you join, the contract will probably govern the dispute. So if it is not written in the contract, don't rely on it. Is there a cooling off period? Some spas give you several days to reconsider your decision to join after you have signed the contract. Can you get a refund if you need to cancel? If you move, become disabled, or just want to stop using the spa? Can you get a refund or get out of your contract? This is especially important if you choose a long-term membership. Can you join for a short time only? It may be to your advantage to pay a little more money and join for just a few months. In that way, if you are not enjoying the membership or using it as much as you had planned, you will not be committed to many years of payments. If you have any further questions about the athletic club or joining a health spa, please make sure to contact us at the East Brunswick Consumer Affairs Office. We're located in the municipal building. Our hours are 9 to 5, Monday through Friday. Again, the telephone number is 390-6954. Thank you for joining me on Consumer Aware.